So today we are going to discuss the upcoming approval of PSMA-based radiopharmaceuticals and how this is going to impact the management of our patients with advanced and probably down the line localized prostate cancer. So let me start with the first question to our esteemed colleague, Dr. Khalise. So Jeremy, please tell us about the upcoming approval or upcoming PSMA-based radiopharmaceuticals. What drugs are coming up?
Yes, very good question. I will try to stay synthetic. Radiopharmaceutical therapy equal molecular radiotherapy equal radionuclide therapy. You have many different names to say that you are administering on an IV setting in the blood a molecule that is radioactive, seeking for a specific target in the body to deliver locally some radiation. That's what we're doing with these drugs or treatment. These are radioactive drugs with a specific target. Here we're talking about the target PSMA, a target that is highly overexpressed by prostate cancer. We see very nicely visually this overexpression on PSMA targeted PET imaging. And now you can use this same overexpression converting contrasted imaging into high therapeutic index ratio. And the aim here is to be able to treat still in a targeted manner and almost focal manner lesions that cannot be treated by ablative treatments such as surgery, radiation therapy, or other types of technique like that. So it's kind of a hybrid approach between a systemic drug and some focal treatment more targeted. Now, the one that is most down the road and close to approval and clinical use is lutetium-177 PSMA-617. Let's call it lutetium PSMA. There is a cold compound called PSMA-617 on which is attached the lutetium, the radioactive agent. The PSMA-617 will go into the blood, go where the PSMA protein is overexpressed in all the prostate cancer lesions of a patient, and will deliver locally the lutetium that will emit some radiation and kill some cells where it has been emitted. That's the overall concept. And so, of course, it may benefit for sure patients with multiple sites of a disease that cannot be ablated by focal therapy. The first trial that will be used for registration and approval is called the VISION trial. Our colleague, Dr. Tagawa, will talk about it. Here, it was tested in an advanced setting in patients with mCRPC, metastatic castration-resistant prostate cancer, who already failed 1 or 2 lines of chemotherapy, so pretty advanced. And I'm sure that with more and more earlier stage of disease, because there are multiple trials down the road, will show even greater efficacy in a disease that is more sensitive to treatment, less resistant, less heterogeneous. And maybe we will reach even the point of the oligometastatic stage for our colleagues in radiation therapy with Dr. Tward. We can comment about that, where we could even combine stereotactic body radiation therapy with the PSMA-targeted molecular radiotherapy in early stage.
Yeah. So no, those are great points. So thank you for such a great overview of how PSMA-based radiopharmaceuticals are emerging. They are going to be approved soon and how they are going to impact the lives of our patients.